Thank you for joining Palm Health Foundation for today's Train the Brain event, featuring engaging speakers and an exciting announcement about the future of our work in brain health advancement. We are here at the South Florida Science Center and Aquarium in the world's most advanced neuroscience exhibit, Journey Through the Human Brain. Many local partners, including the Stiles-Nicholson Brain Institute at FAU, Scripps Florida, Max Planck Florida Institute for Neuroscience, and Palm Health Foundation collaborated to support this exhibit, which features the latest research and innovations with high-tech displays, immersive experiences, and state-of-the-art equipment. My name is Andrea Stevenson-Royster. I am the Chief Executive Officer of the Health Council of Southeast Florida and a proud member of Palm Health Foundation's Board of Trustees. Palm Health Foundation is a fundraising and grant-making organization that exists to improve health in Palm Beach County. We believe that everyone should have a long, healthy life and have invested more than $85 million in Palm Beach County's health since 2001. During my time on the Board of Trustees at the Foundation, I have been proud of the leadership we have taken in changing the conversation around brain health. Through the Train the Brain campaign, our grant making and our collaborative work with local partners on community initiatives, the Foundation is reducing the stigma around mental illness and helping Palm Beach County residents understand that taking care of their brains is just as important as taking care of their bodies. Train the Brain takes place every year from October 1st through the 31st and is a community health campaign that promotes brain health messaging and resources and offers free experiential and educational events to the community. Each year, the campaign has a different theme. In 2020, we promoted messaging and held virtual events around the theme, Building Resilience and Self-Care in the Face of Adversity. And this year, Palm Health Foundation chose the theme, Connecting Brain Science, Community and Care, because of our commitment to advancing brain research. The science behind what we know about the brain can seem intimidating or hard to understand, but it's important for our community to learn about the innovative research happening right here in our backyard. Local advancements in brain research will inform how we learn to take care of our brains every day, for health longevity, and how we treat brain illnesses. And on that note, we are thrilled to announce an exciting chapter for the Foundation. Palm Health Foundation has committed $1 million to support the Florida Atlantic University's program in computational brain science and health. This is the exciting start of a 5-year partnership between Palm Health Foundation and the FAU Brain Institute with the goal of advancing brain health research locally. Let's chat with Palm Health Foundation's President and CEO, Patrick McNamara, and FAU Stiles-Nicholson Brain Institute's Executive Director, Dr. Randy Blakely, to learn more about this partnership and how the cutting-edge research happening at FAU will impact resident well-being. Dr. Randy Blakely is driving FAU's Stiles-Nicholson Brain Institute to be at the front line of understanding and treating the neurological and mental health disorders that afflict us globally, while preparing the next generation of research for success and educating our community. Thanks for being with us this afternoon, Pat and Dr. Blakely. We just announced Palm Health Foundation's investment in FAU's program in computational brain science and health. Dr. Blakely, in layman's terms, can you tell us what computational brain science is?
Computational brain science is the use of powerful computing approaches and modeling approaches to understand the complexity that allows our brain to develop, function, and also what happens with our brains as we age and in some cases have brain disease. I think maybe the best way to understand the complexity of the brain is right here at the South Florida Science Center in the Human Brain exhibit sponsored by the Palm Health Foundation. The exhibit has a feature in it called Deep Dive. And in that exhibit, one can, even children, take a dive from the outer part of the brain down to the level of individual molecules. And at each level of that dive, what you see is amazing complexity, but also a marvel. And it's that marvel we seek to use these new advanced techniques to dissect and then apply what we learn for the betterment of human health.
Please give a few examples of the types of research happening in the program in computational brain science and health.
So I mentioned that there are these different levels of complexity in terms of how the brain is built and wired and functions. And so we might take a few examples from each of those levels. So for example, we're all beginning to learn about the genetics and the complex interactions of brain molecules that ultimately allow us to live healthy lives, and in some cases, when those interactions between those molecules and genes and the environment aren't functioning. Now, every cell in the brain has hundreds of thousands of molecules that are whizzing around inside and interacting with each other, and those interactions change over time. That's what we call plasticity. And plasticity occurs throughout life. And in order to get a grip on it and understand now not just one cell, but the billions of cells that we have in our brain and their trillions of connections, we use computational techniques to try and put that information together and learn about brain disorders. Some examples that are being pursued at the FAU Stiles-Nicholson Brain Institute involve things like understanding how genes work together to trigger risk for addiction, and then how we can use that information to tailor precision therapies for individuals in our community. Secondly, let's take it up to a different level. Let's go up to brain circuits. Brain circuits, as you know, are very complicated as well. And their interactions change over the lifespan, and they're also subject to problems when we encounter even hostile environments. But we tend to think about things like drugs of abuse or diseases that either come to us from heredity or come from the outside. And in my case, I work on several different disorders such as autism, attention deficit disorder, and depression. And we can model these disorders using genetic model systems that allow us to look at brain networks in a way that we can then manipulate them to see if we can reverse some of the traits, make our models, our animal models, more resilient to threat and to changes in the environment. And lastly, another level of complexity, now we take it up to the way the human brain functions. And what we're learning with these powerful new techniques we have, aided by computational sciences, is that the human brain has even more complexity and more plasticity. And if we're going to understand risk for brain diseases, we have to work very hard with these approaches to put that all together, and we're doing that at the Brain Institute. I might add that the new program in computational brain science and health will take root in a new building that is under construction right now, should open next summer, that will give us a beachhead in this area. It's where the program will have its home, and it will have about 55,000 square feet of research space, both wet lab and what we call dry lab, which would be where computational sciences are held. And in that new building, we'll have a multitude of research centers that target different aspects of brain health. For example, Alzheimer's disease, autism, we'll have a Center for Computational Neuroscience, and even a center for the resilient mind, where we hope to take all of these lessons that we're learning and test out new models for how we can remain resilient throughout our life.
Pat, Palm Health Foundation's vision is for all Palm Beach County residents to have opportunities to thrive and reach their full health potential. How does this investment in brain research connect to that vision?
So the connection is simple but powerful, and it really goes to the old adage of knowledge is power. The more we understand about the way that the brain works, the better equipped we are to be able to do something that helps us to improve our health and well-being. And the more we come to understand about the brain, the more we see that it is central to our overall health and well-being.
And what is the local impact of brain health research, and how will community residents directly benefit?
So it's a great question. There's many different ways, going back to, again, that idea that knowledge is power. And the community participation and learning is very rich. And Dr. Blakely is going to mention some of the ways that they go about engaging the community and encouraging community participation. But there's three other primary ways that I think it's important for residents to know. First is in the education pipeline. This is such a tremendous benefit for our local education system. There's been such an emphasis on STEM, and rightfully so, but preparing future brain health professionals, this is a huge boon for our area. And so, and a real boost to the quality of our education pipeline. So that's a big one. Next is the positive impact on our economy, our local economy. This is, you can think of it as like a really strong capital magnet that is being developed through this brain research hub. And when I say a capital magnet, I'm talking all kinds of different capital, not only the financial capital, but intellectual capital, human capital, social capital, all of those things. And there's just really a spin-off effect for that benefits our economy. And then ultimately, for me, one of the things that's most exciting and the promise of improving the way that we approach mental health, behavioral health, and how we treat brain disorders.
Very good. Thank you. Thank you. So, Dr. Blakely, where can the community go to stay up to date on breakthroughs in brain health research happening at the Brain Institute?
Well, a simple way is to go to our website at ibrain.fau.edu. But we do a lot more than host a website. Actually, with the gift in computational brain science and health, the Palm Health Foundation is renewing its commitment to our community education program called Brainy Days. Brainy Days is a month-long celebration of brain science and brain health, where we bring leading scientists to the community to talk in layman's terms about advances in brain science and applications for brain health. And so for the next 5 years, we've been renewed for our program, and we're very excited to continue to lead that program. Palm Health Foundation also contributed to a new unit that is called Mobile Minds. And this is a van that takes technology out to the community that may not have someone to take them to a beautiful science center like this, and to tell the lessons and importance of brain science and brain health. So that's one way in which we reach the community. And I guess lastly, we talked about the new building that's going up in Jupiter. And one of the features of the new building is an area I called our collaboratory. And our collaboratory is a meeting space, convening space for scientists. For example, FAU scientists interact with the scientists at Max Planck or at Scripps, but also for our scientists to meet the community directly and to bring the community into our laboratory environment and teach them and talk with them about some of the challenges they face, and make sure that we understand exactly what our charge is, and to then relay back to the community what exactly we are doing. And we have so many bright young people that are being trained through the new gift that will have also a responsibility to communicate. And so we won't let them sit in their ivory tower. And I can tell you, we've been floored since I came at the spirit, the passion, and the capability of this student population. They often join us here at the Science Center and for events that Palm Health Foundation sponsors. And so that one will be a no-brainer.
Pat, Dr. Blakely, thank you for being here this afternoon.
Your
Pleasure. Thank you for facilitating that conversation, Andrea, and for your leadership in our community. In addition to her work at the Health Council of Southeast Florida, Andrea is committed to lifelong learning for the benefit of our local healthcare landscape. The Foundation is proud to share that Andrea recently became a Fellow of the American College of Healthcare Executives, a major accomplishment in the field of healthcare management. The knowledge and skill set that Andrea brings to the Foundation's Board of Trustees is invaluable. Thank you, Andrea. And thank you to everyone who is tuning in. After learning about the important connection between local research and access to quality care, we will transition into a presentation from our keynote speaker. Prepare to come away with a deeper understanding of the connection between neuroscience and mental wellness. Dr. Arthur Evans is the CEO of the American Psychological Association, the leading scientific and professional organization representing psychology in the United States. Dr. Evans spent 12 years as commissioner of Philadelphia's $1.5 billion Department of Behavioral Health and Intellectual Disability Services. In that post, he emphasized a data-driven population health approach, which improved outcomes for diverse people with complex needs. The system in Philadelphia has become a national and international model, particularly for governments desiring to improve health equity. Prior to Philadelphia, Dr. Evans was Deputy Commissioner for the Connecticut Department of Mental Health and Addiction Services, where he led major strategic initiatives that included the increasing use of evidence-based practices, addressing healthcare disparities, implementing a recovery-oriented policy framework, conducting research, and improving community engagement. Over the years, Dr. Evans has received numerous awards and recognition, including being named as an advocate for action by the White House's Office of National Drug Control Policy. Dr. Evans holds a doctorate in clinical community psychology from the University of Maryland and a master's degree in experimental psychology from our own Florida Atlantic University, where he was inducted into the university's Alumni Hall of Fame. Today, Dr. Evans will speak on what brain research has taught us and how we can apply that learning in addressing our community's behavioral health needs.
Thank you, Pat. And thank you, everyone, for being here. I'm so honored and delighted, especially being an FAU alum. What I'm going to do today is talk about maybe a way that we can start thinking about behavioral health differently. And I'm going to talk about a population health frame and why I think it's so important for our work in the field. And so let me first start with just beginning to lay the foundation for why I think we need to adopt a different way of thinking relative to how we promote behavioral health. And I'm going to use the term behavioral health because I'm going to talk about both substance use and mental health conditions, and just talk about it as behavioral health. But ultimately, when I talk about behavioral health, what I'm really getting at is how do we promote psychological health for individuals? So let me tell you how we do it now and what some of the challenges with that. The first point I want to make is that the way we think about and approach behavioral health conditions is inadequate for the level of complexity, the ubiquity of these problems, the impact that they have, and it doesn't really line up with the science around what we know about these conditions. So the first problem is I don't think the paradigm is inadequate, and I think we need a new paradigm. Secondly, when we look at what has happened because of the pandemic, there is an urgency for us in terms of looking at our paradigm and looking at how we approach these issues. I'm a firm believer that if we do the same thing, we will get the same result. And then the third point I want to make is that we have growing and widespread disparities based on different characteristics on where people live, on race and ethnicity, on sexual orientation, And that one of the things that we have to pay attention to if we are trying to promote overall good health for people is to understand those disparities and make sure that we're addressing them. So if I'm going to ask you to adopt a new way of thinking or a new way of looking at these issues, I should at least start with what is our current paradigm. And I want to suggest to you that the current paradigm is a black box paradigm. And the way the black box paradigm works is this. We build a box called treatment, and it could be inpatient program, it could be an outpatient clinic, it could be an outpatient mental health office, doesn't matter. The idea is that when people over here have a problem, they have to seek out help for that problem. They come to us, we diagnose them, we figure out what's wrong, we treat what's wrong, and then we discharge them. And that is how people derive the outcomes they are seeking when they reach out for help. Now, this model, this mental model, this way of thinking about how we help people is very widespread, and it has helped millions of people. It's the way I was trained, the way most psychologists, psychiatrists, social workers, counselors, we're trained to wait for people to come to us, diagnose what their problem is, treat that problem, and that is how we obtain health. So while it's helped a lot of people, we know that there's some challenges. And if we were together, one of the things I always like to do is interact with the audience. And I would ask you the question, what are some of the challenges with this as a mental model for addressing behavioral health concerns? First thing you would say is, well, look, most people who have behavioral health conditions don't come and seek out treatment. We know that half the people who have a mental health condition, 90% of the people who have substance use condition are not seeking out care and coming to treatment for those conditions. And for some populations, that number is even greater than 50% are not accessing treatment. So first problem is we're missing a lot of people. Second problem you would probably point out is that even if people come, many of the people leave and they really don't engage in the treatment process. The modal number of outpatient sessions, for example, is 1. So if you looked at all of the people who go to outpatient, the most frequent number of times that people will go is only once and then leave. You would point out that when people leave, that they are not fixed, that there is an assumption that if you come to treatment and you go through a course of treatment that you're fixed. The reality is that this is an acute care model for what we know are chronic conditions. Behavioral health conditions are more like diabetes or other chronic conditions where there may be an acute phase, but you need ongoing support and services often to maintain any gains that you might make in the acute phase of your treatment. You would also point out that it is a box and that we ask people to fit into the box. If you have a co-occurring mental health and substance use condition and you end up in a mental health program, your substance use issue may not be addressed and vice versa. Your mental health issue may not be addressed if you are in a primarily substance use program. And so we often, because it's a box, have a certain way that we approach treatment. And we ask people to fit into that. And if they don't fit into that, sometimes we put the onus on the person. So we use language like the person is recalcitrant, or they are not ready for treatment. They haven't hit bottom. We have all kinds of language that we use that puts the onus on the person as opposed to us looking at ourselves and saying, well, how might we have changed treatment in order to accommodate and meet the needs, the unique needs of people coming in. So you can see that even though this is a very useful model for many people, there are many people who are not well served. Either they're not getting to treatment or they are not getting the level of support that they need to address their challenges. But let me tell you what I think the biggest challenge is. The biggest challenge is this. It constrains how we think about how we help people. So if you ask the typical person, and you watch TV and you see someone being interviewed about, Dr. Smith, what do we need to improve mental health of the nation? They would almost always say, well, we need more treatment. Now, I believe in that. I've spent my whole career funding, creating, delivering treatment services, and I believe that that statement is true. But I also want to suggest that we need more than treatment, and that treatment alone, if that is the only thing that we can do, it's not adequate. And certainly the model for how we deliver that treatment is inadequate, given the magnitude of needs, the unmet need in our country. So first problem is we have a mental model that is not aligned with our scientific understanding of behavioral health conditions and our experience as clinicians and service deliverers. Here's another challenge. This is a graphic depiction of our population. About 25% of the population has a mental health diagnosis, about 75% at any given time does not. The way our healthcare system works is if you're above the line, you have access to healthcare resources. If you're below the line, generally speaking, you don't. If you go to a treatment program and you don't have a diagnosis, you're not going to get help because that provider can't get paid. So the problem with this, let me point out a couple of problems with this. The first problem is that many of the people who are in the 75% today will migrate up, and they will be in the 25% at some other point. But because we are not paying attention to those individuals, or we don't have any resource for those individuals, we miss the opportunity for prevention and for early intervention. Another problem is that even though someone may be below that diagnostic line there, many people have subclinical issues that could benefit from some kind of intervention. We're seeing that very clearly now during the pandemic as we look at the level of stress that frontline healthcare workers are under. We know that many of those people will develop more significant problems, PTSD, depression, anxiety disorders, all kinds of issues, substance use conditions. But the way we're set up now is we're going to wait until they have a diagnosis before we can help. And I want to suggest to you that there are things that we can do today to reduce the risk level and minimally to intervene early. And then one other problem with this that I want to point out, that this suggests that mental health conditions are a binary variable, that either you have a mental health problem or you don't. And the reality is that people are really on a continuum, that all of us over the course of our lives go up and down that continuum, and that anywhere on that continuum, we can intervene to help people have optimal health. So there are a lot of challenges with the way we fund our treatment system and the way we allocate resources, which are really after the fact and reactive, and we don't take and use the opportunity to prevent, to intervene early, to reduce risk. One other point I want to make around some of the challenges is we know what are the factors that contribute to our health. And if you look at this pie diagram of those factors, one of the things that should be screaming out to you is that healthcare actually accounts for only 10% of the variance in our health status, which means that all of these other factors like our human behavior, lifestyle, our environment have a much greater impact, even though we will spend $3.5 trillion this year on healthcare. And we essentially ignore many of the other factors that have a much greater impact on health status, or certainly we're not looking at those issues as ways of improving health status. And we know that we have some opportunities there to look at some of these other areas that can improve our health status. Collectively, we call a lot of these things social determinants. It's things like education, income, food insecurity, housing. And we know that these issues can have a profound impact on our health in general and on our psychological health. And the question for us as a field is, how do we intervene in these areas as well? And what is it that we know that can help people in terms of their health by intervening in some of these other areas. All right, so I hope I've convinced you, at least at this point, that we have some challenges, that we have a lot of things that are positive about our approach, but we have a lot of areas where we are missing people and missing opportunities. But here's the other challenge that we have. Those issues are complicated by the pandemic in which we're living. We know that Americans are experiencing a lot of stress related to the pandemic. In fact, 80% say that the pandemic is a significant source of stress in our Stress in America survey that we do each year. We know that many people are experiencing anxiety and sadness and anger and depression. We also know that people are experiencing disturbances in their sleep, in their eating, in their people are drinking more. About 25% of the population is drinking more to cope with the pandemic and the stress of the pandemic. And we know that people are both gaining weight, unwanted weight gain, as well as weight loss. And so when we know that those things are related to stress, and we know that those things have really long-term consequences if they are not addressed, both for our physical health and our mental health. And we know that the level of symptomatology in the population is about 3 to 4 times what it was before the pandemic. So if you look in the US, for example, this bottom graph here, the level of people reporting symptoms of anxiety and depression, again, are 3 to 4 times what they were before the pandemic. And this is a universal phenomena. That the data at the top is looking at the UK, and again, they have a disparity between or an increase in the level of symptoms that people are experiencing in that culture as well. So we've had a challenge. That challenge has been exacerbated by the pandemic. But one other point I want to make here is that we also know that populations vary on in terms of how they're doing in our communities. The data that you're looking at, the graph that you're looking at, is what's called penetration data. When I was, before coming to the American Psychological Association, I was a commissioner of behavioral health, city of Philadelphia, for actually over a decade. And so my agency had responsibility for the Medicaid population and many other funding streams. And the data that you're looking at is the proportion of people in the Medicaid program that were accessing the behavioral health benefit. In your private health insurance, for example, if you have Blue Cross Blue Shield or some other health plan, the typical penetration rate for behavioral health services is about 3 to 5%, somewhere in that range. But as you can see from this data, in the Medicaid population, what we were seeing is that we're in the 20% range, and it was increasing over time for both adults and children. That is a good thing. Now, the Medicaid population is different, and so you would expect a higher penetration rate. But the good news here is that you're seeing this nice increase, that we're doing more and more efforts to get people connected to care when they need it. However, if you disaggregate that data, you start to get a very different picture of what's happening in the community. You see that the penetration rate for Asian Americans, for example, is much lower, in the 5% range. For African Americans, in the 15% range. And so the importance of being able to disaggregate data so that you actually know what's happening in the community is very important. And what it does in most instances is it reveals inequities in how healthcare systems work and how and the health status of individuals. Now, this is showing access data, but you could look at any number of variables and you could see similar kinds of disparities, and you could look on other dimensions and see these disparities. And so one of the responsibilities we have is to make sure that we close those disparities. So what do we do about this? This is some research from a researcher named Eileen Rothbard, who was at University of Pennsylvania. What Eileen did was to geomap several things. And so let me kind of explain what these 3 maps of the city tell us. One is that she found that there were certain areas of the city where we had lower than expected utilization rates. And it turns out that those areas also were areas where you had high concentrations of African Americans. And then when we looked at the provider mix in those areas, we also found that we had fewer providers given the size of the population in those areas. So what that told us was that part of the explanation for the lower penetration rate had to do with the access to care and making access to care available to people in their communities. And so the fix was, and what we did was we did a request for proposals for programs in those areas. So understanding the disparities is one thing, but then understanding how to address those, and in this case, understanding the structural issues that were driving those disparities is really important. And then using policy and fiscal policy and other policy to address those is really important. So I hope I've made the case now that we have an inadequate model that for the complexity, that if we're talking about promoting brain health, that we are not really focused on that as a nation, and that the mental model that most of us were trained under is a constraint on how we see the fixes to the problem. So how do we think about a different model, a different paradigm? So I want to suggest to you, number one, is that we have to change the goal of our healthcare system and our approach to health in the US. We have a focus on treating pathology, and we assume that if we treat pathology, that then people are healthy. And I want to suggest that the absence of pathology or illness is not the same as health. So the first thing is to realign our thinking. The second point I want to make is that we really need to embrace a population health approach. And so what does that mean? We go back to the pyramid that I shared earlier. You will recall that about 25% of the population has a diagnosable condition. And our healthcare system sort of stops there and says, okay, we can treat these folks who are ill, but we're not really paying attention to the people in that 75%. So if we took this whole population approach, here's what we would do. First of all, we would have effective and efficient clinical care for those who do have a diagnosis. We would have strategies to mitigate risk or to intervene early for those who are at greater risk. And then for people who are relatively healthy, what are the strategies that we can employ to keep people healthy? So this is in essence what a whole population approach is. It's not stopping with those who are diagnosed, but looking really across the continuum of need all the way to people who are healthy and having strategies that are promoting optimal health regardless of where you are on that continuum. So what I want to do is give you a few examples, and then I'm going to end with some suggestions in terms of implications of using this kind of approach. So if we're at the top part of the pyramid, there are a couple of things that I want to say. One is that in a whole population approach, clinical care is very important, and having effective clinical care is very important. And one of the ways that we can do that is ensuring that we are using the science to inform clinical practice. There's a gap of about 17 years between what we know and what we've demonstrated from a scientific standpoint and what is widely practiced in the field. And so part of our strategy has to be, how do we close that gap so that we get better outcomes? I mentioned that I was a commissioner in the city of Philadelphia, and one of the programs that we had was a level of care called extended acute. And basically what extended acute programs were programs for people who are having very, very difficult time where a normal, typical inpatient stay was not working. And so we had people who had lengths of stay that were up to sometimes a year or longer, which, as you know, is not good for people to stay in an acute care setting for that longer period of time. So working with Aaron Beck, who's in Philadelphia, who partnered with my agency to expand the use of evidence-based, science-based strategies throughout our entire system. one of the levels of care that we used those approaches for was this extended acute. And we implemented something called recovery-oriented cognitive therapy. And it's essentially focusing treatment on long-term recovery, but using the science of what we know works to help people achieve those kinds of outcomes. Here's what happened by doing that. First of all, we shortened the length of stay, cut it in half actually. And these are programs that are costing anywhere in the $500 to $600 range. So you can imagine the amount of money that was saved by using these evidence-based practices. So we're making the system more efficient, but we're also making it more effective because people are able to then step down into lower levels of care and be treated in the least restrictive setting. We were able to reduce restraint and seclusion, assaults, the need for PRN medication. And most importantly, we're able to put people on a track that step them down through services that put them in the community and help them to achieve the kinds of outcomes that they were looking for. So using the science, really important strategy. And there are other strategies that we can use to improve clinical care, but that's one of the most important. Secondly, how do we reduce risk and mitigate risk? One of the most important factors that contributes to risk is the exposure to trauma. So here's one way that we address that in terms of addressing people who are at greater risk. So this is, again, a map of the city of Philadelphia. I mentioned that we had an initiative to create evidence-based practices throughout the city. The dots that you see there are evidence-based programs for the treatment of children for trauma and being exposed to having PTSD. So what we did was to screen children in primary care settings, the places that children were already going, and other settings that were child serving systems for exposure to stress. About 30% of those children screened positively, and we were able then to refer them to evidence-based treatment approaches. So this is a great example of how identifying people, in this case children, who are at greater risk, and then intervening at the earliest possible moment. We also utilize strategies to actually try to reduce risk of exposure to trauma. So there are multiple ways that we can work at that middle part of the pyramid, but the important thing is not to wait for these individuals who we know are at greater risk to develop problems and then come to us in this and for us to be in a reactive mode, but we can move to identify people early and intervene early. Last example I want to give is this one. How do we keep people healthy? We actually know a lot about that, and we do this quite often on the physical health side. We talk about eating right, exercise, getting good sleep. That we know that all of those are things that prevent illness and keep us physically healthy. Well, similarly, there are things that we can do to keep us healthy from a psychological standpoint. And there are various things that we can do to improve the mental health literacy of our population so that people are actively taking ownership over their own mental health and doing those things that promote health. So let me give you just one example of how we can shift what we're doing. So one of the strategies we employed in Philadelphia was to do work in the community, send teams to the community, and do what we do for physical health. Almost all of us have been to a health fair where we've had our blood pressure or other kind of health screening done, or we've gotten information. So we decided, well, what if we took that same approach for mental health, send teams that are trained in understanding the system and these kinds of strategies into the community in the places where people are naturally going. When we first started doing this, people said people will never come up to a table in these public settings where people are talking about mental health. And it turns out that people actually do. And when we put these teams in places like public parks and train stations and coffee houses and libraries. Lots of people would seek out information either for themselves or for their family members. They would do screening, so we could screen people in the same way we screen people for high blood pressure. We can screen people for mental health challenges, connect people. And almost every time we did this, there was at least one person who was suicidal, or having suicidal ideation that we were able to connect to services. And so it really makes you think, what if we weren't there? What if we weren't there that day? What if we weren't there to provide information for people who may have been struggling and may have gotten much worse because of that? And this notion that we should wait for people to come to us, we need to expand that. So we absolutely need to be there when people come, but we can also reach out and meet people where they are. So let me summarize by saying this. There are many things that we can do to reach more people, to have people to have a much better chance for recovery from their condition, and for people to have good psychological health. And so here's some recommendations for moving forward. Number one is the importance of having a population health approach where we are working across the continuum of need, not just those who are having difficulties, but reducing risk and helping people to stay healthy. Secondly, we need to make sure that we are looking at the disparities in our communities, understanding where those disparities are and how we can address those, because we will not have a robust, healthy population if we have those kinds of inequities. Thirdly, it's really important for us to promote psychological health and behavioral health activation, mental health literacy and activation. And simply that means a big part of a population health strategy is not just being available to provide services, but educating people so that they can take more ownership over their own health and they can take action on their own health. So that it is us working together, the professional individuals working with people who are in the community. Fourthly, we need to integrate social determinants and understanding how social ecology impacts on health, and be willing to intervene in those areas in addition to the more traditional ways that we have intervened with people. And then finally, it's important for us to expand our approach to psychological science and really move beyond biomedical solutions. Most of our research dollars are focused there. And as we've demonstrated, there are many factors that impact on people's health. We need to understand those better. We need to develop interventions in those areas. We need to study those interventions, and we need to make sure we're using the full breadth of the tools that are available to us. And we can only do that if we have a research agenda that matches that way of thinking. So I hope I've been able to stimulate your thinking, to present a new way or a different way of thinking about behavioral health care. This is something that is done more widely in physical health care, but I think that this way of thinking is really important for how we move our field forward and how we reach people who are suffering needlessly in many of our communities. So I thank you. I appreciate being here. I'm honored again. And I hope at the next time I get to talk to folks, I can be in Boca and see old colleagues and see folks there who are doing this work. Thank you very much.
Thank you, Dr. Evans, for that insightful presentation. Palm Health Foundation is promoting the importance of good brain health through Train the Brain events like this, community initiative work, and our grant making, which wouldn't be possible without our generous donors. Thank you. Through our Brain Health Innovation Fund, we are leading change in brain health advancement across Palm Beach County. So far, the Brain Health Innovation Fund has funded mental health first aid trainings for individuals, including first responders and educators throughout our community. The fund has responded to the opioid crisis, promoted mental health in the workplace, and commissioned a study by seasoned experts to improve our mental health system of care for children and families. There's still so much more to accomplish. Palm Health Foundation wants to put Palm Beach County on the map as a national leader in brain health advancement by strengthening the local bonds between scientific research, community, supports, and quality care. Our support of the FAU Brain Institute's program in computational brain science and health is a significant step in that direction. We are excited to bring you along on the journey with us. To stay up to date on Palm Health Foundation's work in brain health advancement and to support the Brain Health Innovation Fund, visit palmhealthfoundation.org. There's more to look forward to this Train the Brain month. We'll be sharing weekly brain health tips on our social media pages, so look us up. We'll also hold one other Train the Brain event. Please join us virtually on Tuesday, October 19th from 1 p.m. to 2 p.m. for The Power of Attention, Finding Presence and Purpose, featuring keynote speaker Dr. Amishi Jha, professor of psychology at the University of Miami and director of contemplative neuroscience for the Mindfulness Research and Practice Initiative. Dr. Jha will share insights from her brand new book, Peak Mind, and 60 lucky attendees will win a free copy of the book. Visit palmhealthfoundation.org to register for the event. Simply registering for the event enters you for the chance to win. Let's continue leading a movement to advance brain health in Palm Beach County together. Thank you for joining.